And welcome back to the show. The Restaurant Opportunities Center, better known as Rock United, is a not-for-profit organization that's fighting to improve wages and working conditions for the nation's restaurant workforce. They provide training and professional development opportunities for restaurant workers. An essential pillar in Rock United's mission is to facilitate economic mobility for people in some of the lowest paid occupations in the nation. In addition, they also educate employers on improving the workplace climate by improving tools to advance racial and gender equity and reduce on-the-job harassment of any kind. Rock United is making a variety of efforts to support restaurant workers impacted by COVID-19, as well as the efforts to help through the shutdowns across our country. And joining us now to share a little bit more about it is from the Restaurant Opportunity Centers United is Dr. Sekou Siby. And thank you, Dr. Sekou, for being with us.
Welcome. Thank you for having me.
Glad to have you, and much needed. And we talk about what is going on today, COVID-19 having an extreme impact on every business, but particularly that of restaurant workers. So for somebody who doesn't know, give us a little bit about how the restaurant industry has been severely impacted by COVID-19.
Yeah, most of our workers have been affected by COVID-19, number one, through losing their job or through reduced hours. Today, the Labor Department is talking about 25 million people who have lost their job, and a quarter of that number happen to be working in the restaurant industry.
And when we talk about working in the restaurant industry, there are so many jobs that are attached to the restaurant industry. We know the restaurant workers are really a part of that lifeblood, and even to a certain extent, have become essential workers to people who've been really navigating this. But as essential workers themselves, they've also found themselves in the midst of a lot of challenges. What can you tell us about the challenges with restaurant workers?
The challenge of restaurant workers are something that's well known and well, according to the Labor Department. Not only that the restaurant industry was one of the fastest industry in the country, in producing wages, income, but it has also one of the lowest, 4 of the 10 lowest wages are in the restaurant industry. So these are workers who are people who are working very hard, but who are getting very little out of their hard work. And I can talk from my personal experience. 20 years ago, I was a banquet cook. I was a prep cook at Windows on the Wall, and this situation is very familiar to me because I lost my job as part of 9/11.
Wow. And how have you been able to recover since then?
It had been very difficult at that time. The reason why I understand the situation of COVID-19 today is people losing their job, but because their wages are so low that it is quite impossible for them to have saving. As a result, they lose their job. They rely on the government subsidy to help support their family, and that too is not forthcoming. After the suspension of the $600, the workers are very, very much suffering. And for the most part, especially women, we hear that many of the workers are not going back to work, but the reality is there is a lot of women who have childcare issues and they can't leave the small children alone at home and go to work. So it is quite impossible for them to go to work, even if there is job available when they have kids who are not attended to.
Right. And you're talking a lot about living wages, right? Because that is a major thing that's needed if restaurant workers are going to be able to actually survive post-COVID-19, that living wage. Give us a little bit about the fight for living wage and where things are right now.
Where things are right now, in many places, the federal minimum wage is around $7.25 an hour, and it is far less for tip wages, which is still $2.13 at the nationwide. So some states have have raised the tip and minimum wage, but for the most part, the tip minimum wage is so low that it is even the industry that rely on customers to pay the wages of the workers, which is understandable. You get hired by a company, we assume that company is responsible for your wages, but in the restaurant industry, that's not the case. A good portion of the workers, 40% of those who earn tips, have to rely on customers to earn the full wages, and we don't think that's right, especially at this moment when they apply for unemployment insurance. They can, because they don't have anything much money, because the wages paid by the employer was about $2.13 for the most part in the country.
Mm-hmm. And I think when you talk about a living wage, I mean, that's one important concept that's connected to restaurant workers. But then also I understand the big challenge is also job protection, being able to maintain that job, keep that job, even in times of trouble. So where do things stand with job protection? And what are some of the things that maybe restaurant workers are dealing with that we as the general public are not so familiar with?
Yeah, the restaurant workers have been dealing with many issues. Fair labor standard, for example, has been violated multiple times, meaning we all know the minimum wage. ROC has been engaged in campaign in New York City where we won more than $10 million in back wages, which are wages that people have earned but was not paid until we conducted a lawsuit to force the company to pay those wages. One of the companies was Mario Batali's company, and we settled those at $4 million. So the wage is low, and it is not being paid properly because many employers follow the law road. This is why the mission of the Restaurant Opportunity Centers is to improve wages and working conditions. So it is not enough to raise the wages. It is also important to improve the working condition, because when those wages go up, we have conducted studies in the industry showing that the majority of the high earner positions in the restaurant industry are white male. Why? Because there is no equal access and equal opportunity for those front of the house position where you can make a decent living. And that's wrong.
Yeah, a lot to actually contend with. Talk to me about right now. We know that the numbers are continuing to go up across New York City, across the state, and across the nation. Are you overly concerned with how that's going to impact the restaurant workers, given the fact that there are going to be doors that are going to be closing again simply because of the spike and the surge? How concerned are you with this new surge that's happening and possibly, potentially, what we're considering a second wave?
Yeah, we extremely concerned. I would say back in 2010, we conducted a research showing health and safety of restaurant workers. From that point, what we said was providing paid sick day is a public health issue. We did not see paying sick day as anything else than public health issue, because we believe that when a worker is sick and it doesn't stay home, it tends to get more people sick. Now, today we are very concerned because most restaurant workers, or many of them, especially the immigrant population, they are in multi-generation housing. So you have a father, the grandparent, and the worker in the same household. So they can't protect their family, they can't protect themselves. So it is very important that then they are sick, that they find a place where they can, protect themselves and their family. They don't have that luxury, they don't have that option. So the only option available for them is really to get the maximum protection from their workplace. So we have been fighting.
The workplace is certainly the place that's, that's needed to be for sustainability. Looking right now at sustainability, are you hearing a lot of concerns from restaurant workers with regards to PPE, personal protective equipment? Do the workers find that there's enough equipment in the establishments that they're in?
Yeah, we heard concern from many restaurant workers that the protection is not adequate, it is not there. They did not like the concept of New York City opening because of 25% indoor dining. We don't think 25% will bring a significant amount of money, and that's not worth putting anybody's life in danger. So we have heard concern from the workers about it. And we also heard a concern about the fact that, many customers, we are in a country where, science is not acknowledged by everybody. Many customers don't even consider COVID-19 as a disease, yet to say they're willing to protect the workers against that disease. So they're having behavior that's not compatible with, health and safety condition that the workers want to really protect themselves from. So that has been a contentious, because at the end of the day, the customer is king. The customer desires need to be, executed properly, but it is difficult in this condition. So our members' work is getting a bit more complicated in this COVID-19 situation.
Share with us about what you have upcoming in terms of dealing with the workers, and also how you stand united with them.
Yeah, we have been fighting for the protection of workers, primarily health and safety concern now, which is we've been fighting for the Essential Workers Bill of Rights, which has a lot of components. It is 2 weeks paid sick day. A study has just shown that the cities and the places where the 2 weeks have been provided to workers, those cities have been able to flatten the curve of COVID-19. So we're not only protecting the workers, we're protecting everybody. So protecting workers is literally protecting everybody. And we still continue to fight for the minimum wage increase, because we believe in the fact that a rising tide lifts all the boats, right? So in that condition, when wages go up, it serves everybody. If the economy they need to recover, like it has done after 9/11, like it has done after, because we put workers, we have always put worker front and center. So we will continue to work to fight for it, but we will also continue to fight for the racial and gender equity in the industry, especially all the issues that we want. We don't want to go back to a situation where those workers who want the ability to be in the front of a house and earn higher wages now lose those positions. We've seen that happening after Katrina in New Orleans, where the right to return was not mandated. So many front of the house people of color came back to their job, and they were giving, lower earning position instead of the front of the house position. We don't want that. So these are all the things that we've been fighting for.
Right. And any statistics with regards to front of the house? I mean, we do know that people of color are not predominantly seen in the front of the house, but is there any kind of statistics to support like what's going on?
I don't have it in front of me, but we've conducted what we know is that we conducted a study and sent 400 couple, one a person of color and one a white person, and generally the person of color with a better built resume, and the white person was twice as likely to get the job than the person with more qualified people of color. So it means that we need to desegregate the industry, right? And that's a problem that we will have to contend with. Even if the increased minimum wage is not going to solve the problem if the higher wage positions are not held by women and the people of color.
Well, Dr. Sekou Siby, I got to thank you for coming and sharing. You got to come back to the show. We certainly want to hear more, especially as we get towards the holidays and even into the new year, about how restaurant workers are faring. You were very enlightening to our viewers, and myself and our viewers today, and we'd love to have you come back.
Thank you very much. I live in the Bronx for more than 16 years. So yes, thank you.
Well, glad to have you. A firm Bronx, strong Bronxite, Dr. Sekou Siby. Thank you very much for being with us here.